Relationship between hip joint space and contact pressure by Daisuke Suzuki, Hokkaido Chiotose College of Rehabilitation. Background. Contact pressure evaluation using finite element methods shows that the contact pressure of dysplastic and normal hip were nearly identical. A mere 0.5 mm increase in cartilage thickness significantly increased contact pressure. It was suggested that cartilage thickness has a large effect on contact pressure. The aim of this study to evaluate the joint space size three-dimensionally and to evaluate how the size of the joint space affects contact pressure. Materials. For this study were 45 CT images. All CT images which were visited Sapporo Medical University Hospital. 15 hips were normal groups. Those have no obvious pelvic deformity. 30 hips were developmental dysplasia of the hip or DDH group. This group has further divided into two subgroups. One is posterior wall deficient DDH or PWD DDH group. The other is common DDH or CDDH group, including 15 hips. The definition of the PWD DDH was anteversion angle at the height of the proximal 1/4 of the femoral head center is not greater than 10 degrees. The CT images were three-dimensionally reconstructed, and the joint space area were extracted. The load area was defined as a place where the femoral head is exposed to load of 0.1 Newton or more. The load area was divided into four areas at the center of femoral head. There is anteromedial, anterolateral, posteromedial, and posterolateral area. The thickness of the joint space, nearly equal cartilage thickness, was shown by drawing contour lines. Finite element analysis. We evaluated the contact pressure when the minimum joint gap is 0.5 mm, 1.0 mm, 1.5 mm, and 2.0 mm using mechanical find version 12 RCCM. Bony elements were reconstructed from the CT images and assigned Young modules from CT value. Cartilages are created with 3D modeling software, Trimatic Materialize, and was imported to the mechanical finder. Conditions of loading. Torque load of the upper body on iliac auricular plane. Pelvic load to the pelvic center of gravity. Gluteus medius mass load on the iliac wing. 5% of body weight when standing. Conditions of constraint. Pelvic symphysis. Completely restrained except in vertical direction. Distal femur completely constrained. Results. Mean joint space distribution of PWD-DDH group. There is no peak in the center, except for posteromedial area. Relatively dense and complex contour lines. This slide shows CDDH group. As in PWD-DDH, this group also has no peak in the center too, and relatively dense and complex contour lines. This slide shows normal group. This group has peak at the joint space of 2 to 3 mm and has concentric contour lines. Distribution of the contact force for each model. There is 0.5 mm in minimum joint space, and this is a 1.0 mm, 1.5 mm and 2.0 mm. Effects of changing joint spaces. The graph on the left shows the relationship between contact area and joint space. The graph on the right shows the relationship between contact pressure and joint space. Mean contact pressure is not affected by the joint space, but the maximum contact pressure decreases as the joint space increases. This effect will be less if the space is 1.5 mm or more. Discussion. There are many studies that have investigated the joint space of the hip. Among those, the following are likely to be related to this study. The previous studies report the joint space is about 3.5 mm. The patients with DDH have more joint space than normal people, unless there is severe bone deformity. Summary of joint space for each group. The percentage of joint space greater than 3 mm is smallest in the normal group. Normal group has thinner cartilage than DDH. Distribution of joint space in the normal group. Cartilage thickness is about 1 mm thinner than previously reported. This may be a beam hardening artifact because the hip joint is deep within the body. Some of X-ray spectra are absorbed. Relationship between hip joint space and contact pressure. Mean contact pressure does not change much as joint space thickens, if contact area does not change much, while maximum contact pressure decreases as joint space thickens. However, does not change much when the maximum joint space is 2 mm or greater. Normal cartilage is thinner than the DDH patients, and CT imaging makes it even thinner. It means that the normal group shows overestimated maximal contact pressure, and DDH group does not show affected much because they have thicker cartilage. Is this the reason why there is no difference in maximum contact pressure between DDH and normal groups? Conclusion. The thickness of the joint space measured from the 3D CT image is approximately 1 mm smaller than the previously reported measured value. Thus, the hip joint is prone to beam hardening phenomenon. In the normal group, the contact pressure is likely to be overestimated due to the beam hardening phenomenon. Finally, when creating a finite element model from CT images, it should be kept in mind that the joint space is underestimated. Thank you for listening.